So good evening, everyone. So I'll be presenting my talk on role of Octa in retina practice. And at the outset, I would like to thank AIOS for this opportunity. So what is OCTA or OCT angiography? Basically, it's a non-invasive imaging technique which is used to provide a three-dimensional visualization of the retinal and choroidal vasculature. So basically, how is it different from OCT or how is it an add-on to OCT? So OCT, basically there's a light beam which is split into a exploratory arm and a reference arm. And the difference between what the signals we get between the two is made into an A scan. So what Octa works on is something called as motion contrast. So retina per se is a static tissue, but what is moving is the red blood cells in the retinal vessels. So what happens is that if we take multiple A scans at a single point, the static things will not change, but what will become apparent is the things that are moving, the red blood cells. So a decorrelation signal is made, and this leads to a decorrelation map, which we see as an Octa map. So as we all know, there are different OCT technologies, time domain, spectral domain, and swept source. Swept source is the latest. It has a longer wavelength, so more penetration, better choroidal view. But the thing is that it is costly. So why Octa? Till now, our mainstay of retinal vascular imaging has been fundus fluorescent angiography and ICGA. So what Octa is, it is non-invasive. It is not using any dye. So the risk posed to the patient because of the use of dye, which can be from a mild allergic reaction to anaphylaxis, we do not encounter that with Octa. And plus, because there is no dye leakage. So there is no obscuration of the retinal structures because of that. Also, it not only images the superficial capillary plexus, but the deeper capillary plexus are also imaged. And a better visualization of choroid is there. So we've discussed all these points, and it is useful in patients who have a contraindication to that dye, patients with chronic kidney disease or any other relative or absolute contraindication to the dye. And because it is non-invasive, we can do it again and again. We can do it in cases which require recurrent vascular images, which are such as patients which are being treated with anti-VEGF therapy for AMD or DME. Where there are so many advantages, there are limitations as well. So because you have to take multiple A scans at a point, so the imaging time increases. The field of view is restricted, so the peripheral retina cannot be imaged that well. And it cannot, as I already told you, visualize dye leakage, so which is a common landmark of vascular inflammatory pathology. And it is riddled with artifacts. There can be a motion artifact if the patient moves the eye or patient blinks, so you'll have those lines. Or there can be a projection artifact where the superficial vessels, they are projected onto the deeper layers. There can be a segmentation artifact where there is edema, so we have those segmentation lines. There is an upper and lower border, and these segmentation lines lead to the formation of those slabs. So then we might misinterpret the results. So moving on, how to interpret an Octa scan. As a general rule, we have to keep in mind that we have to look at these few things together. First is the NFAS image. Then we have to correlate it with the B scan with the flow overlay and also the intensity, the structural intensity image. So for example, this is the fundus photograph of a known case of AMD. So our area of interest is the macula, and the OCT has been done through that. So these are the various slabs that we see in OCTA. This is the full retinal thickness, this is the avascular slab, and this is the choriocapillaris. So as we see in the choriocapillaris, you can see this well-defined network of vessels. Now we'll correlate with this with the B scan and the flow overlay. So you see that in the B scan also, there is this irregular PEDs, and you see those, and you see the flow below the RP. This suggests that this might be type 1 MNV. And also the signal intensity is good. So there is not much of shadowing artifact. Now, where do we clinically use Octa? So it can be used in diabetic retinopathy, retinal vein occlusions, and AMD. Now, how is it used? So Octa, because it is non-invasive, so it can be used for screening as well as follow-up in the patients. So in diabetics, we can see an enlargement of the FAZ or their vascular changes. Like here, you can see that NVD can be very well appreciated on Octa as meandering vessels, and there is hyperreflectivity at the vitreoretinal interface. That's another picture of neovascularization at the disc. Similarly, here there is reovascularization at disc. This is before laser and this is post laser. So you can see the regression of these newer vessels. In retinal vein occlusion, what Octa shows are areas of vascular non-perfusion and microvascular abnormalities and neovascularization. So here you see this area, this dark area. This is the area of capillary dropout, and these are the new vessels. This is the neovascularization elsewhere. For in AMD, the role of Octa has been invaluable because it can image the deeper layers better. So the ability of Octa to visualize the choriocapillaries in intermediate AMD and later stages of disease has shed light onto the etiology of this disease. And based on OCTA, basically we classify, as you all know.
Would you say etiology or location only? No?
So location,
Only.
basically the location, whether it is type 1, type 2, type 3, depending on whether it's sub-RPE between the retina and the RPE, or it is coming from above and then...
Neha, you can wrap up soon. Because
Hanji, sir. So this is a picture of, this is an OCT of a CNVM with subretinal fluid and on Octa here you can see a neovascular membrane at the RPE fit. Similarly, this was a case of polypoidal choroidal vasculopathy that came to our OPD. So on the B scan, you can see flat irregular PED, and on Octa, you see this branching vascular network. And this is a follow-up of the same patient after multiple anti-VEGF injections. And you can see the reduction in the intensity and the branching of the vascular network. So what I want to say is that Octa is being a non-invasive technique can be used in cases where the dye is a relative contraindication, especially in cases of AMD where the imaging of the deeper layers is much better with OCTA. Thank you.
Thank you, Neha, for enlightening us on Octa. We will have some discussion after all the Octa talks finish.